Joining us for another CEO sit-down is Romil Bahl. He is the head of PRGX Worldwide. That's the world's largest recovery audit firm. Romil, good to have you with us on Taking Stock.
That's good to be here. Thanks for having me.
What exactly is an audit recovery company, PRGX Global? What does a company like yours do?
You know, PRGX, with a prior name, since we renamed only early last year with our new growth strategy in place, but under the name of Profit Recovery Group and Howard Schultz, which came together to form PRG Schultz, we basically pioneered recovery audit services, which are the services analyzing the procure-to-pay transactions of our client companies with large, complex procurement environments, where errors are still made, even in today's technology era. And we recover those payments and basically take a percentage of that, but it's dollars straight to the bottom line of our clients.
Now, are the kinds of audits that you do, are they related to fraud, or are they related to just the complexity of the billing or procurement cycle means that companies just really don't have a handle on all the pieces that go into these expenditures?
Yeah, it really is the latter. We have an entire new fraud service that we've just incubated as part of the growth strategy again in 2010 that we're excited about taking to market more proactively next year. But our core business, Pimm, really is that complexity that you refer to. And I don't want to make this sound like it's our clients not having a handle on things, because, you know, as we like to say in the business, they get it right 99.99% of the time. But that 0.1% of the times that they don't get it right is enough for us to recover over $1 billion a year, which is what we've averaged over the last 5 years for our clients. And again, like I say, that goes straight to their bottom lines because it's prior period recoveries, and we take a percentage of that.
But doesn't it also indicate that there's something amiss with the complexity of the systems that they are interacting with? So, for example, if you have a major corporation, they're going to be interacting with third-party health insurers that are going to be interacting either with the government or with the actual providers of the health care.
Sure.
So the companies themselves don't necessarily have control over the whole billing or procurement or payment cycle.
No, that's right. So let's talk about these two different things. The most complex procurement processes in the world are in retail and in healthcare, right? For slightly different reasons. Retailers buy everything they sell. So very, very complex, lots of deals, lots of moving parts, lots of allowances, rebates, things get missed. And we will find those misses, and we will recover those dollars from their suppliers. In healthcare, the cause of complexity is, you know, it starts with a physician or a nurse scribbling something on a treatment plan. It gets translated by someone in the administrative office in the back. It could go through dozens of systems that have to all interface absolutely accurately for that claim to come through correctly, and sometimes it doesn't, right? And so different causes, but essentially complexity.
Now, have you seen any changes that were made in these practices based on your participation in the system? And because once you come in and do the audit, I would assume that you've got to give a report to somebody, and they say, well, all right, then maybe we've got to go to that third-party provider or in the retail space into the supplier and say, we've got to change the way we do business.
You're hitting a great insight, and this is something we picked up on. You know, I've been with the company now almost 2 years at PRGX.
January 09, I think.
January 09,
right.
So it's getting right on to 2 years, and we have adopted a proactive mantra to go cannibalize our business in the sense that we will absolutely partner with our clients to improve their systems and processes, as we should. And some of that's been happening anyway. You're absolutely correct in assuming that we are a leading sort of indicator of process or operational issues that can and should be fixed. Now, here's the interesting thing, Pimm. Over time, as some categories of audit are shut down because processes improve, systems improve, new categories emerge. Trading practices are changing all the time. Healthcare practices are changing all the time. And that drives entire new categories of audit. And total audits, total recoveries at our top customers on both sides of the pond actually increasing about 3.9% CAGR a year right now.
So what's the effect of the healthcare reform legislation? Because I imagine waste, that's a big issue.
Yeah, absolutely. And look, of the several interesting things we're looking at for 2011 and beyond, healthcare is absolutely an exciting, almost sort of structural phenomenon where the government has, through the Patient Protection Affordable Care Act, mandated that recovery audit take place across all Medicare and Medicaid state programs. So we're expecting some, you know, close to 50 RFPs out of the states. And then, of course, we participate already in the Medicare Part A, Part B contract.
All right, we're
so
going to leave it there.
Romil
Bahl joining us from PRGX Global. Thanks for the insight into audits.